secondo me. Che dici?
Però sapevi.
Confusionaria, ma sapeva.
Furuse della Rama is present?
Hello.
Yes.
Good morning.
Morning. Morning.
Hello. I also wanted to say hello to Professor Cheska as well.
Hello.
Nice to see you again.
It's a pleasure to see you again.
Different kind of examination. Good luck.
Thank you so much.
We'll give Professor Cheska the honor to interview you.
Okay. Delaram, nice to meet you again. Can you start by summarizing your the document? Sorry.
Yes. Okay. So this is my passport that I uploaded, and this is my identity card.
1 second.
Okay.
Sì, ecco qua. Yeah, that's fine.
Okay,
Fine.
which is the right one? The one.
Yes, this is what I uploaded. Yes.
Okay, good. So can you start by summarizing your experimental thesis and your lab experience so
Yes,
far?
of course. So I have a bachelor's in cell and molecular biology, and I got the chance to perform some small lab experiments during those days that I were a biotechnology lab assistant. So I performed different techniques regarding the microbiology lab with the overproduction of the astaxanthin and zeaxanthin from yeast and bacteria. But my main focus in science in general started during my master's. So I have a master's in neuroscience from the University of Trieste, and I conducted my thesis at CISA under the supervision of Dr. Falcone and Dr. Ciani. So my main focus was studying the glial cells, specifically astrocytes. To be more specific, I studied varicose projection astrocytes in epileptic patients due to hippocampal sclerosis and CNS tumor, and also checked the morphology of these varicose projection astrocytes and the accumulation in aging brains as well. Besides this, I performed a comparative study of microglia across different mammalian species, including human, cattle, bat, and mice as well. Regarding our varicose projection astrocytes study, basically, we had some samples from the epileptic patients, and we realized that these varicose projection astrocytes that have like long processes with the varicosities on top, they can be seen in the cortical layers, specifically in human and great apes. And what we realized is that they can accumulate, and the number of them can increase when it comes to a pathological state like epilepsy. If you want to even compare the pathological state, the amount of these varicose projection astrocytes was way more in the epilepsy due to hippocampal sclerosis compared to the CNS tumors as well. And what was really interesting about our finding was the fact that these varicose projection astrocytes were absolutely absent when it comes to the neonatals and infants. And when we have an aged brain, this amount of the varicose projection astrocytes can increase dramatically. So in the aged brain and let's say the teenagers, this amount increased in the aged brain by 15 times. So what was really interesting that we can say that the aged brain is working like an let's say an acute type of inflammation, but like an inflammation in a really low level. That's why these cells appear. What is really interesting that this is a recently defined type of cell, because back then it was believed that it's a subtype of astrocytes, but it is not the case. This is a reactive state of astrocytes that can appear when we have a pathological state.
So how can you? So basically, they are varicose astrocytes that change their morphology during some pathological conditions, for example, epilepsy or in aging. So how did you demonstrate, or how was it demonstrated in the literature that this is the case?
Mm-hmm. So basically the main focus of our research, we're using the immunofluorescent technique. So for studying the astrocytes, we used GFAP, of course, NEO-N as well, and DOPI for aiming the neurons and the cell body for DOPI to track the exact cells that we want. And at the same time, I used IBO1 because my next project was about the microglia as well, just to aim this one. So what was that was the main focus of this study. And of course, for the counting of the cells, because we had different samples, different sex, both male and female with different ages. So we had to perform the counting as well of these varicose projection astrocytes. So we used the image JPG. And after this, of course, we did the two-way ANOVA and of course, other statistical analysis using the graph path prism, but come up with the graphs and the further statistical analysis as well.
Yeah, no, but my question was, how can you be sure that these are normal astrocytes that become reactive rather than a different type of astrocytes? What was the main evidence for this?
So the main evidence was the shape of the morphology of these astrocytes. Yes, absolutely. Because if I want to compare a normal astrocyte to a varicose projected astrocyte, they have extremely long strands, which is extremely longer compared to a normal astrocyte. And they have like beads on each basically strand that is basically located in a specific space from each other, which is completely absent in a normal astrocyte. So what was really important here is the morphology.
But don't you have, or aren't there any markers for the identification of these changes or for astrocytes in general?
So the marker that we used was GFAP, but at the same time I used S100 beta. But what was really more useful by identification of these varicose projection astrocytes with GFAP, because they are the most common marker when it comes to a reactive astrocyte. What is something about these varicose projection astrocytes that I have to say, that we already know about the presence of these astrocytes, but there is no information yet about the mechanisms behind these and how they can develop.
Okay, we'll ask you maybe one more question and then I can pass. So you didn't select any specific topic. So can you tell us what your interests are for your career in research, and if you saw any of the available projects that attracted your attention?
Absolutely. So I got the chance to talk to Dr. Zonta and Dr. Gonzalo, because their research is also focused on astrocytes. We had different Zoom sessions about our projects, and I was really interested in their work because they check how these astrocytes can regulate the neuronal circuit in pathological conditions and also the health condition, let's say. What was really interesting, because traditionally most of the neuroscientists were focused exclusively on neurons, but the fact that the astrocytes can actively sense neuronal activity through intracellular calcium signaling, it can be a huge thing, because they can release signaling molecules that can influence the synaptic plasticity, let's say, cerebral blood flow, and they can play a crucial role when it comes to disease progression. And the fact that Dr. Gonzalo also focused on epilepsy at some point was really interesting for me. And the techniques that they use in the lab is based on the calcium signaling and observing how the calcium can affect this. Was really fascinating for me, because during my studies at the University of Trieste, I got the chance to visit Dr. Cingolani's lab as well, that is focused on the calcium imaging, and I learned a bit about this technique as well. And what was really interesting about the future of this work of Dr. Zonta and Dr. Gonzalo lab was the fact that they're not only focused on the pathological states, for example, Alzheimer's disease or epilepsy, they are considering the fact that how these astrocyte and astrocyte neuron communication would affect some other conditions, for example, stress. So this is something that they're considering, which is really fascinating for me.
Okay, thank you very much.
Thank you very much.
That's
Of course.
more than fine for me.
Yeah, it's fine. So good luck and
Thank you
goodbye.
so much. Thank you so much. Bye.
And we move.